Okay, well, it just turned 1:15. We'll go ahead and get started. Welcome everybody to our return of a weekly update on COVID-19 here in the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for IU. We will start with some opening remarks. First of all, from Bloomington Mayor John Hamilton.
Thanks a lot, and thanks for everybody joining. As you know, we added this press conference going away from our biweekly because of some of the significance of the data that you're going to hear about today, mostly from others than me. But thank you for that, and I think it signifies that we've got some real concerns. Just sharing the city data specifically as I do, we had 11 cases of positive confirmation of infection from COVID in our workforce this week. That is the single highest week total ever in our 22 months of reporting on that. So while that's anecdotal, it's sobering that we had that many cases in an individual week. The CBU numbers, the City of Bloomington Utility, continues its monitoring. I will say that we did not see a deterioration in those numbers over the past week. In fact, they went down slightly. So to the extent that that tells us much or anything, and we still don't know exactly, but the Bleacher Pool numbers went from 180 copies of the gene per 100 milliliters down to 160 in the past week. And the Dillman, the larger Southside wastewater treatment plant, went from 670 last week to 530 in the most recent test. So those are marginally down, but at least they're down. We still are at just over 70% of our employees demonstrating their vaccination. So you're going to hear very specifically about the broader indicators of local challenges. I know from Penny Caudill from the health department and Brian Shockney from health and our friends at IU and the county as well. And we'll let that information be shared. I will note that the whole state is having very serious problems. We are, the data I saw, we are the 11th worst state in terms of vaccination percentages overall. So we're in the bottom quarter of the nation for that. Other indicators of particular issues are half of the case growth, the case numbers growth, and more than half of the hospitalizations in the country have been, the increases have been centered in just a handful of states around the country, including Indiana, as well as Michigan, Ohio, Pennsylvania, and some others. So we are really experiencing the surge in particular ways in the country. We know 17,000 people have died in Indiana from this pandemic in the last 22 months. That's about 10 times the rate of traffic fatalities, just to put that in perspective, 10 times as many people dying from this pandemic. And another way to think about it, what the cost of that is, this real ongoing cost, is that number equates to losing the entire populations of Ellettsville, Nashville, Indiana, Spencer, Indiana, Mitchell, Indiana, those four cities altogether, losing that many people, our neighbors in Hoosier neighbors, to death from this pandemic. It's very serious. I'll quote the governor, who said, "This is a pandemic of the unvaccinated." He is right to point that out and right to emphasize to all of us how important the vaccines are and getting the boosters moving forward. We say that every week, and we will continue to say that. And finally, then I'll just note, we continue to focus on the safety of our workforce with the Occupational Safety and Health Administration protocols and rules that are coming out that are going to be indicating even stricter mandating for masks for those who are unvaccinated, and trying to be careful to protect everybody that we can in our workplace. I'll close just by saying congratulations to IU Health. They had, of course, a huge weekend last weekend, successfully opening up the new Regional Academic Health Center. Spectacular effort and heroic work from all. And we so appreciate having that resource, which is so dedicated to all of our health, and wish Godspeed going forward, and hope we can not need it as much as we do right now. But thanks for making that work, and on the whole community, we thank you for offering those services as you do. Back to you, Chuck.
Okay, let's check in with the Monroe County Department of Health and Penny Caudill, who joins us on the phone.
Great. Thanks, Chuck, very much. I am joining you, as you said, from the phone, but I think I have some helpers online who will be sharing some information while I'm going through some of this information. And the first thing that you should see is some information about a nearby mobile clinic in Brown County, and I'll touch on that in just a moment. We are in an orange advisory. We had 279 cases per 100,000 this past week, and our positivity rate was just under 10%. To put that in perspective, last week we had 150 cases per 100,000, and our positivity rate was just under 6%. Every Indiana county has over 200 cases per 100,000, and there are some counties that have over 500 and 600 cases per 100,000 this week. Every county, all 92 counties, have an advisory level that is either orange or red at the moment, and that is not the direction that we want to go. It is certainly the opposite direction that we had hoped we were in. Delta does continue to be the dominant variant that is circulating. We haven't seen Omicron yet, to my knowledge, in Indiana, but we feel like it is probably knocking at the door. Case-wise, we are back where we were last year, and this time last year before vaccinations really were starting. So hospitalizations and cases do continue to be driven by those who have not yet been vaccinated. We have only about 1% of our cases are in those who have been vaccinated. So as you should be able to see on the flyer, Brown County is hosting a mobile clinic from the Indiana Department of Health, and that's where the National Guard comes in. They are there today and tomorrow from noon to 8 p.m. It's at the fairgrounds. They have all vaccines available. They prefer an appointment, so planning helps if they know how many to plan for and what people need, and it's faster if you have an appointment, but it is not required. So that is another opportunity. They also have testing available for individuals as well. So the next bit of information that I want to show on the screen, if we can, is the ourshot.in.gov. Where else can you go to get vaccination? And our current vaccination rate stands at about 58.1% of our eligible population. We do anticipate that will continue to rise as we finish the second doses of our 5 to 11-year-olds and they become fully vaccinated. So by the end of the year, I think our numbers will see a good little jump in that. Remember, when they were added, we were just over 60% fully vaccinated of our eligible population. We really need it to be much higher than that and encourage you to seek out and find a vaccination site if you need your first dose, your second dose, or a booster. The best way to do that is to visit ourshot.in.gov for vaccine availability. And when you go to that site, if you will click on site, and then you can find the counties that are available. And I would go to Monroe County first, but maybe you live in another county and you want to go there, or you're visiting there, or it's just you work in that county. You can go to that county, see what's available. You can also just search mobile clinics. Every week there are mobile clinics throughout the state, and they rotate where they go. We've had several here in the county, so you can search by that. You can search by zip code if you want. Now, do keep in mind that if a site has filled all of their appointments and there's no availability yet, you may not see it any longer on that site. So we just wanted to really show today how people can find vaccination for them. Our second dose super shot clinics are going on this week. We were at Richland Bean Blossom Schools last night and did over 270 second dose vaccines. We're at MCC tomorrow, and we anticipate doing over 500 vaccines, and those students will be fully vaccinated by Christmas Day. We do continue to go into schools individually, and we continue to do vaccinations at our public health clinic and at various outreaches. This past week, we have administered well over 600 vaccinations, so we're pleased to continue to do that. We also offer flu vaccinations and routine vaccines along with those COVID vaccines in our clinic on Miller Drive. So there's lots of work going on. It's not all COVID, even though that is what takes up most of our time right now. We are requesting a mobile unit here in Monroe County for early January. We are working out details for that at this moment. And then I think you may hear more today about some other opportunities as well. So just wanted people to be able to see, get a better idea of what the site looks like if you were trying to find vaccination. Now, testing is also very important as our number of cases are rising. There are certainly more people who need testing. And we know that the Gravity site, the Indiana Department of Health Gravity site that is located on Cook property has some challenges since it opened up. But it is on Curry Pike. It is at Curry Pike and Jonathan. That's the best way for me to tell you where it is. They should have some new signage coming, including if they have to close for some reason, that there will be a sign indicating that. So they are also working to get some shelter for staff so that they are not experiencing these closures due to weather. So we're hoping that that is resolved or will be resolved by the beginning of the week, and that we can fully utilize that site. It is a drive-up or a walk-up site. There's no appointments for this Gravity site, so you just show up. They are normally open from 8 to 4, Tuesday through Saturday. If they are fully going and working to their capacity, then there may be options to expand those times, but right now they are not at capacity. Hopefully the closings that they've had will be a thing in the past, and we're excited to see them be able to be open more often. It is important to remember that if you have symptoms, if you have been a close contact, or that you are just concerned that you may have been exposed, that testing is vital so that you can respond appropriately. Proper isolation and quarantine measures are very important tools for reducing the spread of this virus. And then I just want to also mention, as people are asking about Omicron, the dashboard will be changing, and in anticipation of growing questions about Omicron, the state will be updating the dashboard to include a graph of variant cases each week, and it will just simply list Delta, Omicron, or other. And I will end today by saying thank you to everyone who is following guidance to protect themselves, their families, and the community. Thank you for vaccinating, getting your booster, testing as needed, and masking up. Back to you, Chuck.
Okay, let's next go to the Monroe County Commissioners and Julie Thomas.
All right, thank you so much, Chuck. Thanks everyone for being here today. That is a great segue. I just want to issue a reminder to all of our residents and anyone who's visiting Monroe County that when you're indoors, you are required to wear a mask, and that does protect vulnerable in our community. It protects yourself, protects your family at home. It protects our small businesses, and it protects our essential workers, especially our healthcare workers who have been on the front lines of this from day one and have dedicated themselves to our health and well-being. And we cannot thank them enough, but one way we can thank them is to get vaccinated and to mask up. So with that, I also want to add that we do have a resident alert system on video.monroe.in.us. Click on the megaphone and you will be alerted to the availability of a mobile site, any health order updates, along with traffic and weather issues related to the winter. So just sign up and you can receive information via text, email, or phone, or any of the above. Also, our Township Assistance Fund continues for Monroe County residents. We'll be looking at possibly expanding that again next week during the commissioners meeting. So keep an eye out for that. And with that, we want to thank everyone who's been vaccinated. Thank you. And we want to thank everyone who wears their mask. Please be kind, please be respectful, and put it over your nose and mouth. Thank you so much. We'll take questions.
Okay, let's next check in with IU Health and Brian Shockney.
Hello all, and thank you for being here today. I wish I had better news in regard to our patients requiring inpatient care. As you can see, our numbers have nearly doubled from where we were a week ago. We're seeing the same trend in the numbers between IU Health Bloomington and Monroe Hospital combined. So now I want to show you our journey through this pandemic, and our current trajectory demonstrates we could easily outpace our highest inpatient numbers to date through this pandemic. 2 of our IU Health regions have already surpassed their previous highs for the entire pandemic, and it looks like we will most likely be doing the same. This means that our resources are going to be stretched beyond any previous requirements during this pandemic, and is requiring us to implement any and all measures to ensure we can care for patients, including limiting our surgical volume. As you can see, this pandemic is still a pandemic of the unvaccinated. Initial data seems to tell us that we're experiencing a slightly higher percentage of patients vaccinated that are requiring inpatient care. Currently around 21.5%, where 3 months ago we were averaging about 12.5% of vaccinated individuals requiring inpatient care. So that booster is extremely important. This speaks to the need of making sure that we're also safe at holiday gatherings. Lots of things happen before Christmas, lots of holiday parties and gatherings. As Commissioner Thomas said, wear that mask over your mouth and your nose when you are in with others. Since the beginning of the pandemic in the state of Indiana, over 17,000 deaths have occurred, as the mayor stated, and these, can be prevented mostly by just getting the vaccination. This surge on top of surge means healthcare providers have even less chance to get a break from this pandemic and all the care and stress related to it. So we are concerned about our healthcare providers and workers as this continues. It's taking a toll on our mental and physical well-being. So as we continue to offer our team members resources to assist during this difficult time, the thing you can do is to get vaccinated, follow the precautions, and keep slowing the spread of this disease. IU Health is also seeking support from the Indiana National Guard. The IU Health South Central region has welcomed the support of the National Guard during this most recent surge. They are in all of our IU Health facilities here in the South Central region currently and arrived this week. We are grateful for that assistance. These citizen soldiers are focused on protecting and serving our country and now also our community. I'd like to take this opportunity to also recognize our National Guard troops throughout the state that are doing this across the state of Indiana in healthcare and our providers. And I would also like to recognize our colleague through this pandemic, Officer Kirk, for his 30 years of military service. He represents that guard, that military support that we have been receiving, and we are appreciative in many, many ways. I'm happy to take questions at the end.
Okay, let's next check in with Indiana University. We'll start with Aaron Carroll and go to Kirk White.
Thanks. I'm going to be short and sweet because everybody has already said the most important messages, which are, can get vaccinated, get boosted. We are finishing classes as of today. This is our last week of what we call COVID check testing, sort of our asymptomatic mandatory testing for unvaccinated students. Next week, we'll have departure testing for people leaving, and then next Friday exams are over and we are done for the semester. This week in general looks a bit better for us than last week. Last week we had a bit of a, I won't say surge because it's still not that big, but we had an increased number of cases after Thanksgiving that is still higher than what we were seeing a month or two ago, but it appears to have been coming down a bit this week. Still, almost all of our cases are symptomatic. Almost all of our spread is household transmissions. We do see some others from social gatherings, but the numbers remain reasonably minimal, which is a test to the very high level of vaccination and how much good that could do in the broader community. So we are going to we'll have symptomatic testing for the days our student health clinics are open, Monday, Tuesday, Wednesday of both Christmas and New Year's week. But otherwise, we will not be doing voluntary testing or other asymptomatic testing. The campus will mostly be closed. Most students will have departed as of the end of next week, and we'll be preparing for starting everything up back again in January, where hopefully we'll see a decline instead of an increase. But as others have noted, projections are that it will likely get worse for the next few weeks before it starts to get better. There's nothing we can do more or that would achieve more than continuing to work to get everybody boosted. And so happy to take questions.
Okay, Kirk.
Oh, thanks, everybody. And hey, President Shockney, thanks for the nod to our National Guard soldiers. I think as I mentioned earlier this week, I talked to many of them before I retired last year, and I said, before this is over, you're probably going to be called state active duty. And sure enough, the state needs you. And these are soldiers that in many cases are healthcare workers in the community as well as medics in the Army. And so you'll recognize many of them that'll be working in our hospitals across the state. And I salute them for their continued service, certainly. Well, at IU, as Dr. Carroll mentioned, this past week, we saw an upturn of the highest number at the Bloomington campus of COVID infections that we've seen all semester. We bumped up to 105 of total cases for that week of the 2nd of December. As Dr. Carroll mentioned, the trend is down slightly a bit this week, so we're somewhat encouraged. We did go up 1/10 of a point to 94.7 on the vaccination rate, which is still a good trend to be. Now, the great news that I want to share, building on the theme for today of getting vaccinated and Director Caudill's description of the different sites that are available this weekend. Indiana University is very pleased that we've been able to partner with the county health department and the state health department. We'll be sponsoring a special COVID-19 vaccine clinic next Monday, Tuesday, and Wednesday at Assembly Hall. And I'll share the details here so that you can see it in person there. This is not just for our university community, although we're encouraging our students, faculty, and staff to get vaccinated before the holidays, before they leave, to make themselves safe for their families and wherever they're traveling, and for when they return back to the community after the first of the year. But this is a public site as well. So Monday, Tuesday, and Wednesday next week from 3 o'clock to 8 o'clock p.m. at Simon Scott Assembly Hall on the bypass, we'll be offering Moderna vaccines, the first, second shots if you're just getting started, or for a booster if you need that. This will be age 18 and older. That's really what we're best able to do. Younger require different kinds of waivers and things like that. So we'll be doing 18 and over. We encourage you to come on out and make your reservation at ourshot.in.gov. Look for this INDIU Simon Scott Assembly Hall on the directory when you get to ourshot.in.gov for vaccines. That's the correct place to look. So we are really excited about this opportunity to give everybody another chance to get vaccinated. Here's some more details that Amanda did too. The details about it if you want to go online. We've already seen great success. This went live yesterday to sign up. We sent some social media posts out late yesterday. We already have over 700 appointments made for those 3 days. We have capacity for 3,000, 1,000 a day. I just can't say enough about our student health center staff, even our retirees that have come back to help us with organizing this. It's been a great effort, and IU is just really pleased to be able to do this for not just the campus, but for the whole community as well. And as Penny Caudill mentioned, we are looking at some possibilities for us to do another state strike team as we hosted last month. We're hoping to be able to do that in January, so we'll have more details on that. And that'll be right after the first of the year, so we can get the tide of this stemmed as best we can. So that's our update for today. I'll stand by for questions. Thank you.
Okay, and we're all standing by for questions. None in the chat at the moment, so I'll give you guys a moment here and then there we go. Patrick McGurr has got one in here. So this one for Kirk and Aaron. Campus COVID-19 numbers are up. How many students are isolating due to COVID-19, and are we concerned about students either bringing the virus home or from home back to campus after seeing family and friends?
Well, our trend line for isolation is down a bit here at the end of the week. We were up to about 9 in isolation earlier. This week, we're down to 4 now, I think. What we will do is keep our isolation facility open for as long as it needs to be, because if someone needs to go into isolation because they've tested positive, we'll keep them there as long as it takes through the holiday break until they are clear the 10 days later, and then we'll tell them they're welcome to head home. Of course, they might choose to leave earlier, but we would certainly discourage that. But we're going to be able to keep our isolation facility open as long as we need to during the break, and of course, it'll be back active again for the first of the year.
Chuck, I would only add that the numbers Kirk's describing in isolation are, of course, only for those who are isolating who are part of residential housing. Every single one of our students who's COVID positive this week is in isolation. They're just not in our own isolation housing. They're isolating in their own housing, or they've gone home to isolate. So, the number of cases in the last week is a reasonable estimate of the number of students who are currently isolating, because you isolate for 10 days once you have a positive test. As for going home, again, for both those who are housed in our facility, which at this point is just a handful, and those who are isolating at home, of course, we're having discussions with the contact tracers about when and how it is safe to travel. Certainly no one gets on a plane if they are currently isolating from COVID. Driving yourself, however, is relatively safe. And if a parent chooses to come pick up a child, which does happen, that is, of course, a private decision that also can be reasonably safe with masking and being careful. But in general, again, I'd stress that the numbers of cases that we see on campus are lower than the surrounding communities. So there's not a real danger in sort of the IU population going elsewhere, as much as it is often that we're worried when people are coming from other places back to campus, which is often when we see our surges. So we'll be, of course, watching in January when everybody returns, but for the most part, our slow exodus from campus next week should be reasonably safe.
Question from Dave Askins, the B Square Bulletin, for anybody who knows the answer here. Can you confirm that the mix and match advice is still in place for boosters? So if someone got their 2 shots as Pfizer, can they take a Moderna shot as a booster? Aaron, you want to answer that?
Yes. Anyone who has had any of the FDA authorized vaccines can get any of the authorized FDA vaccines, although it is strongly recommended that you get an mRNA vaccine, meaning Pfizer or Moderna, for your booster. There's really no push to booster with J&J, but it really does not matter which one that you get.
Chuck, I might ask Dr. Carroll to amplify a bit there. We had some questions this week about folks who have had COVID in the last month or 2. Is it okay for them to get boosters, and what's the advice on that?
Not only is it okay, it is strongly recommended. Everyone who is 6 months out from their final Pfizer or Moderna shot, or 2 months out from their J&J shot, should get boosted. It does not matter if you've had COVID. It does not matter which of those vaccines that you got. Everyone is recommended to get boosters. Of course, if you are currently in isolation with COVID, don't leave isolation. Wait until your 10-day period is over and you are free to go back into the world. But after that point, there's no reason to wait. Get boosted.
Aaron, I'm going to direct this one to you because you wrote the column in the New York Times this week about availability of home tests. For anyone who knows, is the question from Dave Askins again, are you hearing much chatter about people using home tests instead of going to a testing facility, and any concern that we're seeing an underreporting cases as a result?
Well, I'm not worried that we're seeing underreported cases as a result in our IU constituency, because of course we ask everyone to report to us when they've had a positive case. And in fact, the majority of cases that we hear about these days come from, or actually not a majority, but a number of the cases that we hear about now do come from outside testing facilities, not from within. There could be an underreporting of cases if people are documenting their cases at home with an at-home test and then not reporting it for contact tracing. Of course, I'd still argue that that's better than no testing at all. At least they found out that they're positive and are now isolating. I think that there's increased use of that kind of testing. I believe ISDH and CDC guidelines would both argue, however, that if you have a negative test and you are symptomatic, you still should go get like a full-on PCR test if you are symptomatic. So those who are symptomatic and have a positive test, you've got COVID, isolate. But if you are symptomatic and have a negative Binax test, you probably should still go and have a full-on PCR test. If you're asymptomatic and just trying to have be extra careful or just extra knowledge, then those tests are perfectly reasonable. I'd argue that they should be free and ubiquitous, and we should be sending them out en masse. But if you can get your hands on some, they're a great way to sort of do a precautionary test before you gather during holiday season, especially because it's hard to get in for testing in many other ways at this moment.
And Penny, to extend that just a moment, is that a concern from the county public health department with home tests and getting a number of actual infections that we may have in the community?
Well, it's certainly a possibility, but again, depending on your situation, for instance, return to school, even if someone does an at-home test, they may need to do, they need one from a provider. So there are a lot of situations where even if you had a at-home test result, you may need to confirm that somehow otherwise. At-home tests are not reported, so that is the dilemma there. But I would agree completely with Dr. Carroll. There's nothing wrong with you doing them, and there's certainly a place for them. They shouldn't, however, replace completely getting a PCR or even a rapid from your medical provider who has just more training in doing those tests.
Okay. We have time for more questions. Not seeing one at the moment, but I'll give you a moment and tell you that we do plan on being back next week. We do think at this moment, we are thinking we may arrive an hour and 15 minutes earlier. So we're looking at doing noon next week, next Friday for the news conference. So we will, of course, send out the regular release to let you all know that for sure when we get there later this week. Another question from Patrick McGurr from the HT, this for Aaron. Did we just see the post-Thanksgiving vacation surge?
Well, surge, of course, is a relative word. We definitely saw more cases on our campuses the week after Thanksgiving than we had before. But usually when we talk about a surge, it's concerning exponential growth. This was not exponential growth, and 1 week later, it's actually down. So I probably wouldn't use the word surge. However, I would completely agree that we had an increased number of positives in the week after Thanksgiving that appears now to be abating a little bit. But we are also seeing, significantly increased numbers throughout Indiana. So I'm not sure how much of that is Thanksgiving and how much of that is that there was an increasing value for which we had a week where we didn't have much data because we were mostly at home, having been away for a week. So slightly increased numbers. They seem to be coming down a little bit. I'd like them to come down further, but it is not increasing exponential growth since Thanksgiving.
Question from Patrick for Kirk. Many people still have concerns about masking at Assembly Hall. How do we make sure everyone feels comfortable there?
Well, this has been a real challenge for us. certainly the crowded assembly hall gets tied up in the excitement of things, and there's still an indoor mask mandate in Monroe County, and we're doing our best to encourage people to abide by that. If you're eating popcorn or drinking a drink or whatever in assembly hall, there's the possibility that you take your mask down to do that. And so, though we are doing all kinds of things to remind people, including passing out masks, we pass out 3,000 to 4,000 masks at the doors as people arrive. We remind them through public address. We have our event staff carry signs around to remind people. Our event staff personally reminds people, but there's a group mentality here that needs to happen, where people need to continue to take this seriously. And my hope is that by looking at these numbers today, this week, that it's quite clear that we're not through this and it's not over yet, and we still need to be mindful of those to our left, right, front, and back. But I know the athletics department is taking this very seriously. I've been in discussions with other universities in the Big Ten and asking them how they're addressing it. The other universities are having the same challenges we are with their fans. And Dr. Carroll, I just moved to ask if you have any other points in all this. You've had some discussions university-wide with some of these efforts as well.
I will tell you that if you were to ask Scott Dolson, he could send you an email with a long list of the many efforts that are being made, including, as Kirk said, like handing out thousands of masks, continually reminding people, having people walk around with signs, doing everything we can. But of course, everyone takes their mask down to eat or drink. Food and drink are available in an assembly hall. There's always times when some people who are eating popcorn or drinking water or anything else are going to be unmasked. And I agree. I hear you. So I will say the same thing I say to people all the time when they're concerned about the potential risk of COVID. Wear the best mask you can. Protect yourself as much as you can, especially when you go out into public, especially when you think you would be in crowds. A K95 mask is better than a surgical mask, is better than a cloth mask. And going out in crowds will have an inherent danger in the midst of a pandemic. It's clearly an optional activity. And we absolutely will do our best and everything that we can in order to continue to make Assembly Hall as safe as possible and to help people be as compliant as they should be with Monroe County rules.
Going back to Mayor Hamilton, first of all, there will be a question from Patrick McGurr, but also to follow up, you put something in the chat about the community view on the surge, and if you wanted to elaborate on that. But the question from Patrick is, are you concerned about the impact of an uptick of cases on our ability to offer services? There was a brief interruption with recycling services in the past.
Yeah, thanks. And I'm really just echoing what Dr. Carroll said, which is probably one of the safest places to be is on campus, and that their experience is different from the experience of the community as a whole and the state as a whole, where we are seeing, for example, the hospitalization numbers and others that I think would be called a surge. So I'm not an expert in that, but it emphasizing that the IU campus with its huge levels of vaccinations is where we'd all like to be in a lot of ways. So
yeah, I completely agree. I think a running theme on this is Indiana is in a surge. There is no question. And it looks like it could be our worst surge yet. It's terrible. But I'm not sure that can be blamed on Thanksgiving, because it was starting long before Thanksgiving. And I'm not sure that, to call it the Thanksgiving surge sort of makes it feel like if only we hadn't done something on Thanksgiving would be fine. That is not the case. This surge we were on track for this before Thanksgiving. It has continued after Thanksgiving. I'm sure it didn't help, but there's a lot going on. And again, high levels of vaccination would be the best thing to get us out of this.
Yeah, thanks. And thanks for letting us clarify that. As the question, the short answer is yes. I am concerned about our ability to offer services. We always are. We've been consistently able to do that, and I'm confident we will be, but it doesn't mean there's not a concern about it. We had 6 firefighters test positive. That can have an impact, but we're able to cover all the services that we need to. When we had a particular workforce in sanitation department, which is a couple dozen people, get hit, it did mean we had to adjust the services from that group of folks. But so far, through 22 months, we've been able to make sure everybody got coverage of the fundamental services that we need. And I'm confident we'll do that, but I am concerned because if this uptick gets worse and worse, that certainly can have those kinds of impacts. It's why we're so focused on keeping our workforce safe with the OSHA regulations and making sure people are following those guidelines because it's good for them to stay safe. It's also important for our community to have those services available.
Question from Dave Askins for Brian Shockney. Are there any specific aspects of the new facility that opened on December 5th that you can talk about that are so far proving to make it easier for doctors and nurses to take care of COVID-19 patients?
The answer to that is yes. The private rooms, I will say, first of all, this is the first time in our history we've had private rooms where we can protect each individual patient, but also our doctors and nurses are able to get in those rooms and out of those rooms safely. Our new design also allows our physicians and nurses to view patients from the exterior of each room and document without having to go into the room, having that glass nursing an area for documentation and watching patients outside of each room that we didn't have before. The whole design of our facility and the way we have limited entrances where people come in and out, where we can screen individuals much easier and be sure that they are safe to come in our facility to either visit their loved ones or be in the facility for testing or those kind of things. We have our larger emergency department, although with this surge, we are continuing to see a very high number, actually record numbers of emergency room patients. But if we hadn't moved to our emergency room, we would not have those additional rooms and spaces for our patients. And then lastly, the ability to, with all the new technology, to monitor our patients, and it goes directly into the medical record through our new beds at Way, oxygenation, monitors, all of those things that we could not do in our previous facility that now we can, and we can keep real-time monitoring on our patients without having to wait till that gets entered into the medical record. It then gives us alerts for the care that they need. So yes, there are many things that we are able to take advantage of in this new facility that we wouldn't and couldn't previously to moving in. Thank you for the question.
Okay, that's the last question we have. We'll go ahead and wrap it up there, but a reminder again, we tentatively plan to be back at noon next Friday. We'll send out all the particular information in the usual way, so look for that later this week, and we will see you back next week for another briefing here on the COVID-19 situation locally. Thanks everybody for your questions today.
Thank you, everyone.
Stay safe. Thanks.